Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
And good morning. Welcome to Mon General Hospital's Health Talk as part of Morgantown AM here on WAJR. Jim and Kay out for the week. Kyle Wiggs and Dave Wilson sitting in. And Dave, good morning.
Good morning, Kyle.
Been a fun week so far. We've got 2 more days.
I've been enjoying it so far.
Including our Ask the Experts segment coming up this morning with Mon General Hospital. And joining us is orthopedic surgeon Dr. Matt D'Armelio. And Dr. D'Armelio, good morning.
Good morning, Kyle.
This is your first appearance on Health Talk.
Yes, it is.
It'll go fast, believe me. We'll get a lot in, though. We'll get a lot of good information out there. And I know your specialty as an orthopedic surgeon is with the knees and the shoulders. And we'll talk about that a little bit later on. But the first thing we want to talk with you about is the new state-of-the-art orthopedic surgery center that opened up in January of this year. Tell us all about it. This had to be very, very exciting. First, when you knew that the possibility of having something like this to work with and work in existed, and then when it finally opened, what was that like?
It was very exciting. Mon General has been working on this for several years, and it finally came to fruition. And we have a state-of-the-art 4-room orthopedic surgery center in which we do all of our inpatient and outpatient orthopedic surgery procedures with state-of-the-art arthroscopy equipment, HD cameras, new orthopedic beds to help us position patients better. So from what we had before to what we have now is absolutely incredible.
A lot more room, a lot more things to work with, right?
Yeah, state-of-the-art things too.
All right. Well, how many procedures, how many patients do you see come through the doors? I guess you've only been open since January, but I would imagine you've been able to increase the number of patients that you're able to help surgically in that facility.
Yes. Each year we do approximately 3,600 orthopedic procedures. We have one of the highest volumes of total knee replacements in the state. We also do many arthroscopy, sports-related surgeries. And the way it is set up, we have 4 rooms and usually 3 doctors operating. So there is a 4th room that is used as what we call a flip room. So it allows us to get people in and to their and get a next room ready so that it keeps the workflow going very nicely.
What's some of the most common procedures you guys have been doing in the new center?
Usually our number 1 procedures are total knee replacement, arthroscopic shoulder and knee procedures, hand surgeries such as carpal tunnel, hip and shoulder replacements. And then we have a growing population of elderly, so we do many hip fractures and ankle fractures and wrist fractures in the elderly.
You say you talked about the volume, 3,600 procedures per year. I'd imagine you draw from a wide region, both into Pennsylvania and obviously through central and north central West Virginia, right?
We do. Actually, even as far as Parkersburg and down from Beckley. And I think it just has to do with the outcomes we've had and the connotation in the state that Morgantown is sort of the hub that people think about.
Mm-hmm. My wife's grandmother's reached the age where, those old knees are starting to give out, and she's actually thinking about and considering knee replacement surgery. Kind of walk me through the process. What kind of an experience would you have if you're one of those patients, an elderly senior citizen looking to get knee replacement surgery done? Just walk me through the steps of how that would work at this facility.
Well, first, she would undergo a consultation with one of the orthopedic surgeons, and we like to try all the conservative measures first, which can include non-steroidal anti-inflammatories such as the ibuprofen and Advils, occasionally an injection, such as cortisone, can help decrease inflammation, and some light strengthening type exercises. Once those have lost their efficacy, then you move on to the surgical alternative, which is the knee replacement. There's usually a preoperative evaluation by the family doctor to make sure that from a heart or a cardiac standpoint, everything is okay, and then basically get the surgery scheduled. They'll come in the day of surgery, and they get the surgery done, and then we have a physical therapy protocol that we take all the patients through, so that within 3 to 4 days they are either home with home physical therapy, or some people, if they do live alone, can't get home right away, so they'll go to a rehab facility such as Health South, or one of the nursing homes around have some rehabilitation beds just for these total hip and knee patients.
One of the other things that we've learned about is some of the differences in the anesthesiology part of it, where explain what the regional block program is. It helps you control the pain for the patient and eliminate some of the recovery time as well.
That's a great talking point. The Mon General anesthesiologists have developed a program where they will use lidocaine to numb the nerves going to the extremity. For the shoulder, they'll put the block in. For the knee, they put the block in at the top of the leg. It decreases the use of narcotic medications, and also because it lasts a long time, sometimes up to 48 hours, they experience a lot less pain on the floor as they begin their physical therapy with the walking and the exercises, and has really, in the past year, made a tremendous difference in how patients go through the replacement or surgical procedure.
And this new facility, before we move on, we'll take a break and talk more about shoulders and knees and those areas specifically. But what has it meant for the hospital? What's it meant for the personnel there, the surgeons, the doctors, the nurses, everyone involved? It has to be incredible to be involved in this at this point in time with this new facility being open.
Yes, very exciting. The staff, the doctors, they all love it. It's a great working environment, and we're happy to be part of the Mon General family with this.
Dr. Matt D'Armelio with us here on your Ask the Experts segment of Morgantown AM Mon General Hospital, talking about the new state-of-the-art orthopedic surgery center that opened in January of this year. And as we mentioned, Dr. D'Armelio's specific areas, shoulder and knees. We'll talk more about that when we return, and he's seeing more and more young people with shoulder injuries and knee injuries, and we'll discuss that. Stay with us. Ask the Experts on WAJR will continue after this.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Phone lines are open for Health Talk on this Thursday morning, and orthopedic surgeon Dr. Matt D'Armelio is with us, and we talked about the brand new state-of-the-art orthopedic surgery center that opened in January, and they're very excited about that. State-of-the-art equipment, state-of-the-art facilities, and Dr. D'Armelio, talk about the common things you see. Obviously, there's older folks that need hip replacement surgery and knee replacement surgery, but it's trending down a little bit. You're seeing more and more young people having problems with their shoulders. Those issues are sports related a lot of times, aren't they?
Yes, they are, Kyle. Many of the children today get involved in athletics at an earlier age than probably what we did when we grew up. So we're seeing more overuse type injuries with children. And then the ligament injuries have been on the rise, especially as young girls have gotten into sports at a heavy rate. So your meniscus injuries and your ACL injuries have become more prominent, and we see that a good deal as well. And the most children now play a sport almost year-round, so there is no break time for these kids. They go at it hard. They're on travel teams, and it gives them or puts them in the possibility of getting more injuries.
A lot of specialization, I would imagine, with the shoulders at least. It's probably a lot with baseball, maybe some with tennis. What do the other sports lend to? You mentioned the girls with the knee injuries, and for some reason it seems like those catastrophic knee injuries, torn ligaments, that type of thing, happen more with female athletes.
Yes, and they attribute it to, again, girls playing at a younger age, more involved with a year-round sport, and there have been some question of a hormonal impact, although that's debatable, but it may just be that these kids are involved like they've never been before. Mm-hmm. So with the shoulder type injuries, we see a lot of overuse injuries. Again, the kids pitching, with football, the dislocations. So again, it runs the whole gamut, and we just take care of all these kids as they come along.
Are there measures you can take, whether you're a coach or a parent or a trainer, to help minimize these types of injuries?
Yes, a lot of the children are also involved in training programs to help strengthen the lower extremities and the shoulder. So a lot of, say for baseball, a lot of these kids get involved in younger ages with rotator cuff type strengthening exercises to help control the arm when they're pitching. They also have limited number of pitches that they're allowed to throw. As for the lower extremity, there's been a big emphasis in young women on hip strengthening exercises to help with knee control. And again, all the children or all the young athletes usually are involved in weightlifting programs where they work with a lot of closed chain exercise, and that is where your foot is on something. So they do a lot of strengthening, not just with the knee extension type exercise machine that you would see at a weight room, but with the leg press, another thing called plyometrics, where they're doing explosive jumps to help gain coordination of the brain to the knee, so that when they are involved in these athletic activities where they're cutting, that their extremity has more control.
Does that also play a factor, the training programs that you're involved in, a good training program and one that's designed well so you're not overdeveloping one region and underdeveloping another? Because that can also play a factor, could it not?
Yes, it can. And most of the training programs that are out there in our community, they seem to focus on the total body, trying to get balanced lower extremity with upper extremity, and then also more, again, this term called proprioception, where you are trying to hook the brain up to the joint or the muscle to give feedback. So a lot of with the feet on the ground type exercises compared to just not like just bike riding or the knee extension type machines, but where you're trying to train the brain in these different moves so that it carries over to the field. So when they are in these different positions, these coordinated movements help prevent the injuries.
Now, there's been so much progress made in repairing these injuries. It used to be for an athlete, you blow your knee out, you're finished. You'll never play again. A pitcher in baseball, you tear your rotator cuff, you blow your shoulder out, and you'll never pitch again. But that's not the case anymore. Whether you're young or whether you're in the major leagues, you have a chance to come back. Just talk about that, the advances that have been made really in the last 20 years to get these athletes back out on the court and back out on the field.
That's a great point. You're right. Probably in the 80s, 70s, these were career-ending injuries. And then they started doing reconstructive type surgeries. Take, for instance, the ACL. They would take part of the kneecap tendon called the patellar tendon, put that in there as your new ACL. But still, it was a brace and rehab for 2 years. And then some of the surgeons started noticing that their patients didn't listen to them, and they started playing, and they didn't have adverse problems. And then, so they started looking and thinking, if this person did this, well, maybe we can cut the time to return to play to a year. Then it was a year, and then it was maybe we can go 6 months, and then maybe. So it's almost been the patients have shown us sometimes by not listening to what we've said that they can get back to do this, and then we've taken that to try and base that on everybody now. So a lot of these young athletes and college type athletes, these injuries are not career ending anymore. There is a rehab period to get them strong, and then we work with a lot of the closed chain and proprioceptive exercises we were talking about earlier, and they can get back to the level that they want to compete.
We were talking earlier in that last break about the spring and the summer. The weather's getting very good. People are outside. We're not talking just athletes now, but the weekend warriors. And you see a lot of that in terms of people getting on the bike trail and having a spill, or running maybe a little bit too much and hurting themselves. This is your busy time in that sense, to where you deal people my age, people in their 40s that think they can go out and run a 5K, which we're going to try and do this weekend. Just talk about that and the volume of people you see.
Well, this period when the weather starts getting nicer starts our trauma season, and for that entails everything from bike riding and skateboarding and things that you couldn't do during the winter time. People just run out of the house, and all of a sudden they jump on everything, and they're wrecking the bikes, falling off the skateboards. And we just have this picture in our minds that all these kids just run out right after the weather turns 70 degrees and everybody gets hurt. And this is sort of our trauma season, and the motorcycle injuries. Again, and then a lot of people start with the overuse type things. They've been in the house, and all of a sudden they're going to go run the 5K, and they just start out. They'll pull their hamstring, they'll sprain their ankle. So this is our busy trauma type season, whereas in the winter, people get back in the house, they don't want to come out, and then they hibernate. And so right now, this is the start, and so usually our trauma visits, both to the emergency room, to the urgent cares, will increase exponentially, and then so will our visits in caring for these people.
Dr. Matt D'Armelio with us. He's an orthopedic surgeon for Mon General Hospital. This is Health Talk, and we'll wrap up the show after this. Stay with us.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Final 20 seconds of the show here. We thank orthopedic surgeon Dr. Matt D'Armelio. And doctor, keep moving. That's the big message you want to get out there.
Yes, it's very important as we get older. We keep exercising at least 4 days a week, 20 to 30 minutes. Find something that's enjoyable for you that you like to do with a friend. But going forward, we seem to play all these sports, and then after our 20s, we don't get as active as we should, and it's just very important going forward. 40s, 50s, 60s, 70s, 80s, stay active.
Keep it moving. All right, doctor, thanks. We appreciate it. That's Health Talk on WAJR.